having a baby can be one of the happiest and most important events in a woman's life. While life with a new baby can be thrilling and rewarding, it can also be hard and at times stressful. Many new moms experience the baby blues, a mild, brief bout of depression for a few days or weeks after giving birth. However, 10% to 20% of new moms will experience a more severe form of depression, known as postpartum or perinatal depression, that can interfere with their daily lives. Until now, treatment for postpartum depression was available only as an intravenous injection, but all that changed on Monday when the Food and Drug Administration, or the FDA, approved the first pill for the condition. Zuranolone, sold under the brand name Zurzuvae, is expected to be available later this year. No price has yet been announced. And joining me now from Jerusalem is Dr. Camilla Forkosh-Lavan, a licensed practicing psychologist and organizational consultant. Thank you so very much for being with me here this afternoon. I want to start by asking, what is known about this pill and why the fact that it's now in tablet form is so significant?
First of all, this is beautiful, beautiful news because, again, as we know, about 1 in 7 women will suffer from this, and this is a really big ailment because when you need to be the most functional as a human being and as a mother, when you have a little baby, right, and you're not sleeping anyway at nights, and you need to feed and you need to make sure to take care of it well, right? This is when the depression sets in, and as we know, it's also on a spectrum sometimes with very, very how should I say, serious results, including mortality, right? So it's a very serious condition that I don't think is talked about enough. And to be able to have a medical treatment that a woman is able to take at home instead of sitting in a hospital that's very highly inconvenient, again, you just had a baby, all you want to do is sleep and take care of your baby. Plus, it's very, very expensive, right, the intravenous. And this way, it basically unties the hand of a mother and to be able to take care of herself and of her baby.
And as you mentioned, postpartum depression affects 1 in 7 women, specifically in the US. That's a major figure. It's also important to mention that it's similar to other forms of depression. Now, years ago, the stigma around these mental health issues meant women had no one or no drug to turn to for help. Has this done much to change the narrative on this once taboo issue?
For sure, definitely. Even the fact, first of all, it's long overdue that there is a drug specifically targeting this issue, right? So the fact that there is even, and that someone put in the money and the research in order to battle and help this is very, very important. And also it raises the question, basically what you're asking, and it's a brilliant question of like, where were we until now? And where's the awareness? And with so many women suffer, and is it just because it's a female situation? So like, okay, everyone does it, everyone has a baby. Yes, on one hand. On the other hand, it carries such a serious, often very, very detrimental results that the fact that there wasn't something already in place before now is actually shocking.
For those who perhaps don't know, what are the symptoms of postpartum depression, if you could break some of them down, and how can relatives and friends possibly assist someone that's suffering from it?
Brilliant question. Thank you for asking. And again, as always, I love you all for bringing all these kinds of topics in. So first of all, I think that it's very important to understand that there isn't a woman that potentially cannot not have it, right? Like you as a woman never know which one you're going to be. Right. So that's very, very important. First of all, in taking off the stigma of like, oh, it just happens to those other people, because then you're more at risk if it does catch you. And this is not to freak people out, but just to raise awareness. Yes. Another thing is that's very important is if you realize like and normalize it in a way, right, then it's also you're going to reach out to your friends, your neighbors, your parents, your spouse, whoever is close to you to be able to be on the lookout. Meaning sometimes you might be not the one that's best equipped to realize that you're actually suffering from it, right? And again, it's on a spectrum. So some of the symptoms are like what we already used to from depression of like maybe sadness, difficulty getting out of bed, maybe feeling detached from the baby, maybe even angry at the baby and frustrated. And at the more severe spectrum, it could lead towards psychosis and, unfortunate cases where we heard sometimes of a case where a mother can put their baby in an oven, right? And again, because it's psychosis or also kill themselves. So what they actually perceive isn't necessarily there. And what they're doing, they're not aware of what they're doing. And I think that this is so important. Another thing that's also very important, this is for all mothers out there, whoever's next to them, please make sure that they sleep, because the lack of sleep combined with the hormonal stress and the physical stress, and basically it's a really huge trauma for the body just to even give birth, even though, you know, people think like, oh, it's whatever, everyone does it. Yeah, everyone does it, but the stress on the body is crazy, and I invite you all to read about it, right? So to make sure that there are blocks of time for this new mother to actually sleep, otherwise they start going a little bit crazy.
Dr. Tamila Farrokhrushlev, a licensed practicing psychologist and organizational consultant, thank you for shedding light on such an important topic.